If you have an autoimmune disease, you need to watch this before getting gastric sleeve surgery.
3, 2, 1.
Here we go!
Hello, I'm Dr. Alvarez from endobariatric.com. And if you have an autoimmune disease, lupus, rheumatoid arthritis, Hashimoto's, psoriasis, multiple sclerosis, you might be wondering, is the gastric sleeve even safe for me? Or worse, am I too complicated for surgery? This is one of the most important conversations we have with patients, because the answer is not a simple yes or no. It's much smarter than that. First, let's clarify something. Having an autoimmune disease does not automatically disqualify you from having gastric sleeve or weight loss surgery, but it does mean one thing. You are not a standard case. And that's not a bad thing. It just means your care has to be individualized, which is why it is important to get your procedure at a designated center of excellence or a specialized practice center. Autoimmune diseases happen when your immune system mistakenly attacks your own body, your own tissues. That can affect joints, thyroid, skin, intestines, nervous system, or multiple systems at once. So the real question isn't, can you have surgery? The real question is, how active is your disease? And how stable are you medically? There are 3 major things we evaluate. One is disease stability. Is your autoimmune condition controlled? Is it stable right now? Is it managed with consistent medication? Or is it currently flaring? Active flares definitely increase surgical risk. If inflammation levels are high, if organs are involved, or if lab markers are unstable, we wait. Not because surgery is impossible, but because timing matters. Number 2, medications. Many autoimmune patients take steroids, immune suppressants, biologics, methotrexate, TNF inhibitors. These medications can affect wound healing. They can increase the risk of infection. They have an impact on nutrient absorption. They require adjustment around the surgery. This doesn't mean you just can't stop them randomly. It means your surgical team and your specialist must coordinate. Surgery in autoimmune patients is definitely teamwork. And number 3 is nutritional risk. This is the part most people don't think about. Autoimmune diseases already increase the risk of iron deficiency, vitamin D deficiency, vitamin B12 deficiency, bone density issues, and the gastric sleeve reduces intake. So, without proper monitoring, the combination can create silent problems. That's why long-term labs are non-negotiable. But here's the important part. For many autoimmune patients, weight loss can actually improve inflammation. We know obesity itself increases systemic inflammation, raises CRP, worsens insulin resistance, puts mechanical stress on joints, increases your cardiovascular risk. So in some cases, weight loss after a gastric sleeve will make things go the other way. Reduce joint pain, improve metabolic markers, lower your inflammation, improve mobility, improve quality of life. But again, only when done safely. So now let's talk about when surgery may not be recommended. These are situations where we must be very cautious. For example, severe active lupus affecting kidneys or heart, uncontrolled Crohn's disease, severe malnutrition, unstable multiple sclerosis, high-dose chronic steroid use without control. In these cases, the conversation becomes risks versus benefits. And sometimes the safest decision is to stabilize the patient first. Surgery is not an emergency. It's a strategic decision. There is also an emotional side to all of this. Many autoimmune patients feel that I'm already medically complicated, or I don't want to make things worse, or I've been through enough. And all that fear is, believe me, very valid. But complexity does not mean impossibility. It just means careful planning. The key is a thorough evaluation, clear communication between specialists, proper nutritional monitoring, and long-term follow-up. So, is the gastric sleeve safe with autoimmune disease? In many cases, yes, but only when the disease is stable, medications are coordinated, risks are understood, follow-up is consistent. This is not a one-size-fits-all decision. It is individualized medicine. So if you have an autoimmune condition and you are considering gastric sleeve surgery, don't assume you're disqualified. But don't assume you are automatically cleared either. Have the conversation. Get evaluated properly, because sometimes losing the weight reduces inflammation, and sometimes stability comes before the surgery. The right decision is the one that is made carefully and not emotionally. I hope you found this information helpful. And if you did, please don't forget to hit that like button. Hey, and don't forget to subscribe as well. It helps us keep creating sponsor-free videos just like this. I'm Dr. Alvarez from endobariatric.com, where we are changing lives one sleeve at a time. Take care and God bless.